Thanks, sir.
Good morning.
Sir, could you guide us through or could you take us through a journey when a patient is advised CABG or a bypass? Could you tell us what it is exactly and could you take us through a journey through it?
Yeah, so that is a very good question actually, because nowadays a lot of patients are advised cardiac surgery. The most commonest being coronary artery bypass grafting, जिसको simple terms में bypass कहते हैं. Now obviously the patients have not been through anything like this before. So they want to know how does it go through. So in short, let me just try and explain how does it work. In today's world, in today's era, bypass is an extremely safe procedure. It has got less than 1% chances of mortality. Usually, a bypass patient comes to us with a coronary angiogram wherein most of the coronary arteries or the blood vessels supplying the heart are critically blocked. So they are then advised a bypass surgery. Now we usually admit these patients about 2 days prior to surgery. These patients are usually on blood thinners which are usually stopped 3 to 5 days before surgery. Then why do we admit them 2 days before surgery? That is because we have to convert these medications into certain other injectable medications. Sometimes these patients have very poor functioning of the heart. In such cases, we may have to put them on certain other medications after admitting them in the ICU for a day. These medications improve the contractility of the heart and make it more suitable for surgery. So that is why we admit them 2 days prior to surgery. Now coming back to the day of surgery. Usually at around 8 o'clock they are shifted to the OT. In the OT, the first thing that happens to them is they are put under general anesthesia. This is done by a cardiac anesthesiologist. Along with this, they put certain monitoring lines inside. They put a neckline here. They put arterial lines either in the leg or in the hand. Sometimes we may have to put a line which goes through the heart into the lungs. This is called a pulmonary arterial line, and this measures the lung pressures as well. This takes about 1 hour or so. After this, the surgery starts. During surgery, obviously, we open the sternum and then we reach the heart. After that, we see the blood vessels with our own eyes, and then the process of bypass starts. So before bypass, we start harvesting the grafts. We either start harvesting the mammaries or the veins or the radial artery, and then we go ahead and जितने भी bypasses करने हैं, जितने भी blockages हैं, we go beyond them and we do a bypass. This takes about 6 to 8 hours. After this, the patient is then shifted to the ICU. Once the patient is in the ICU, they would be usually in the ICU for about 3 to 4 days. After that, they are again shifted back to the wards where they would again be there for about 3 days. So the whole process takes about 6 days on an average. Sometimes the patients do get discharged faster. So I have had patients who have gone home on the 4th or 5th day after surgery as well. If the patient is old, if the heart is a little weak, we would prefer giving them more care, keeping them in the ICU for that 1 extra day and then shifting them to the ward. So bypass, as you can see, is a very safe surgery. It gives you the best results, and in safe hands, I am definitely sure that this is a go-to procedure.